See, it looks like everyone's almost here that registered. We'll just give it another minute. Thanks for joining us today. Okay, it looks like it's 2 o'clock right now, and I think, should I give it another minute, Amy, or should I go ahead and get started?
We'll give it
a little. Okay, there's a couple more people I think that registered that aren't here yet.
Not too long ago, Nikki and I did a very similar webinar for youth with disabilities, and it was a small, intimate setting, and so we left it up to them. What do you think we should do? Should we wait a little longer or get started? Wait. And I mean, I think they would have given them 30 minutes. They were very gracious with their time.
Enjoyed that so much.
Yeah,
and I wanted to tell you that I enjoyed
great group of kids. Yeah. Kids and young adults, because there were some in their 20s. That was a good time.
Mm-hmm.
Thank you for monitoring the chat, Amy, too, because with sharing the screen, I can't see that.
I'm going to do a shout out to Sonia. I saw your positive feedback in our survey the other day. Thank you for completing that.
I shared the survey on the military Facebook group as well, so hopefully
Great.
they didn't
Yeah, I've
see
seen
it on
the numbers
main.
there. People are still completing them. The numbers keep going up. So I'm excited about the response rate that we've had.
That's good. That's great.
I see we did get somebody else came into the room, so that's good that we waited a little bit.
Yeah, I think there was one more registered.
Yeah. Is everybody else experiencing sunshine and lovely temperatures in your part of the state? I'm so excited to see sunshine and lovely temperatures, especially with tomorrow's 100% chance for rain out here in the Iredell County, outside of Charlotte area. I'm so over the rain.
It's making me feel like I live back in Washington State again.
Oh, I bet.
All the rain.
I'd say we're probably good to go ahead and get started. Nicole.
Okay. Okay, perfect. Well, thank you everyone for joining us today for our webinar, North Carolina Resources for Military Parents of Children with Special Needs. This webinar is being recorded today and we'll be emailing out the PowerPoint presentation to everyone attending. All of the resources have a brief description and summary on the slides, and there's a link to each resource as well. So we'll go ahead and do some quick introductions. I'll start off with myself. My name is Nicole Bougie. I am the Military Parent Outreach Educator. I am a military spouse as well. I've been a military spouse for 18 years. I have 2 daughters who have, my 16-year-old has autism and multiple other disabilities. My 17-year-old daughter has ADHD and complex regional pain syndrome. So we have been a part of the Exceptional Family Member Program for a long time. I have worked with the Family Voices organization in South Carolina while we were stationed there. I also work with the Parent Training and Information Center, a program under them out of Washington State called STOMP, Specialized Training of Military Parents, for almost 3 years. And I've been with ECAC for just over 8 months. So I'm super excited to be here with ECAC and share this information with military families and support other military families. We were discussing a little bit earlier, if you hadn't joined yet, we have a Facebook page for ECAC, and we also have a military group, ECAC Military Connection. And I'll pass it off to Amy to go ahead and introduce herself.
Hello, everyone. My name is Amy Combs, and I am the PTI Assistant Manager here at ECAC. I've been a parent educator here for almost 7 years, and I just got this new role within the past couple months, and so it's new and exciting. But I'm really excited to be here. I kind of feel like I snuck in. I'm not a military spouse. I'm more like I want to be connected. I am somewhat connected. My father and my brother are both retired colonels in the National Guard. And the house I'm sitting in right now, I'm at my oldest daughter's house. She is a special educator who teaches the adapted curriculum, but her husband is a former Army Ranger who actually lost both of his legs over in Afghanistan. And they have 2 little girls, and one of them, my youngest one, might actually be starting early intervention soon. And so I'm kind of seeing things go full circle. And, if I had not been a parent of a child with a disability myself, that might scare me, but I'm actually excited, like, yeah, you're going to love it. She's going to, she's not sitting up yet, and she's 9 months old, and she just kind of seems to have some low muscle tone overall. So we're navigating that. My middle child, Joey, who's not a child, actually, he's 23 years old and on the autism spectrum. And he had received early intervention through North Carolina's infant toddler program. When he turned 3, he got an IEP through the North Carolina Public Schools, and he had one all through his school career until he graduated at the age 18. And he ended up getting a job with the help of North Carolina Voc Rehab, and has been working at the Troutman Lowe's, which is out in Iredell County in North Carolina. He just is about to celebrate his 5-year anniversary there. And then my youngest daughter is 21, and she is in her last year, she better be, her last year at UNC Charlotte. So I'm very, very excited to be here, and I have nothing but just the utmost respect and gratitude for military families. Just nothing but love and appreciation. And now I will pass the mic to Nikki.
Hello, thank you so much for having me. My name is Nikki Hennett, and I'm the Family Outreach and Helpline Coordinator with the Division of Public Health, which is within the Children and Youth Branch. So I'm based out of Wake County. So I actually staff the helpline for children with special healthcare needs. And so that's just a resource available to families for all 100 counties. So prior to that role, I was a service coordinator with the Sandhill CDSA for 11 years. So I really enjoyed working with the military families stationed at Fort Bragg, and then just helping a lot, just kind of getting families enrolled in EFMP. So a pretty good experience. working with the CDSA and then now working with the Children and Youth Branch. So thank you so much for having me today. I'm looking forward to it.
Thank you for joining us, Nikki. So before we get started, I'm so glad that we have at this webinar for military families and military connected professionals. I feel it's especially important for us military families as we move throughout our journey. Early on in our family's journey, we were told that there was no services for us or our daughter, when in all actuality, there is many services available to us. And I had to work really hard at finding those resources and services. And so it's a passion of mine to provide this information to families. So we at ECAC are all about empowering families that have children with special needs, and we're here for support and information and resources. ECAC is the North Carolina Parent Training and Information Center. Under federal regulations, every state is required to have a parent training and information center, or they're called PTIs. However, some states like Texas and California have multiple. For us, for military families, it's a great resource when we're PCSing to a new duty station to contact them to find out what resources are available in that state. And I'll provide a link on how for families they can find that information. It's parentcenterhub.org. Find your parent center, and I'm going to put that in the chat for everybody. And then also, if there's any military families that you're working with, or for professionals or any military families themselves, if you have any questions or would like a warm handoff to another parent center, please feel free to contact me. We'll be providing our contact information at the end. And one other thing that I really think is important about ECAC is we are for parents by parents. All of our parent educators are parents of children with special needs. So we offer that unique connection to the families we serve. We do have our largest project is the PTI. We do house some other projects. We house the North Carolina Deafblind Project in connection with East Carolina University. We also have the North Carolina State Improvement Project and North Carolina Early Intervention and North Carolina Family Engagement. So for the families that have lived here for some time, and for the professionals, this is just great information. And also it's good for the families that are PCSing here or maybe PCSing here. We hope that this presentation serves as a great resource for those people. And we hope you find this information useful for the families you serve or the families themselves. We want to let you know that we're going to cover a lot of resources during this presentation, but however, this is not an inclusive list. There are many, many more out there. And it's so important to share these resources. And if there's resources that you have that could benefit our work with families, please share them with us as well. And I'm going to go ahead and pass the mic over to Amy.
Thank you, Nicole. And kind of like Nicole mentioned in the previous slide, this presentation is not all inclusive. I actually put this together maybe a little bit less than a year ago, because I was like, there's so much good stuff out there, and there's so many things that families don't know about, or families wish they would have known about. There was things that I was coming across that was like, man, I could have used this 5 years ago, 10 years ago, 15 years ago. And so I was like, I'm just going to start, making a collection of these resources. And I was like, let's put it out there. And Nikki was kind enough to join us then. She's starting to become like family anytime we do this. It's like, can you come and talk too? But I did want to let folks know that there's probably somebody we forgot. It likely wasn't intentional, because there's just so much awesome stuff out there. And I'm still coming across new things all the time. I was like, oh man, I wish I would have had that when I presented on it. But one thing that we can't do at ECAC, especially because we are federally funded, is that, we don't rank or recommend schools. We get a lot of folks that call and say, is this a good school? Is this a bad school? And kind of tell them we can't do that. Plus, we're serving 100 counties. We really don't have, ears and eyes everywhere. And plus everybody knows, my kid had a wonderful experience, but I could probably meet another mom who didn't. And so it's just such an individual thing. So we don't do that. And we don't promote or endorse fee-based services or programs. And it's not that we don't know that there's not some really awesome ones out there. It's just not something that we can do as parent educators or as employees of ECAC. Now, you catch me on the fly and you say, hey, what do you know about this OT clinic here in Mooresville? I can, I'm happy to do that because I personally know so many wonderful service providers out there, but it's just in our role at ECAC. And so these slides are mostly going to be, or should all be, agencies that provide services or programs at no charge, at no cost. Pretty much the same as everything that ECAC does for families. Everything that we do for families is at no charge. And so if I did my ABCs correctly, and sometimes I don't, I try to put these slides in alphabetical order. So hopefully, hopefully now that it's all packaged together, it plays out that way. One of the first resources that we're going to talk about is this group, the Advocates for Medically Fragile Kids, North Carolina. They've got a website and they've also got a Facebook page, and their Facebook page is pretty active. And this is a good place for parents to go if they want to connect with other families that have a child that is maybe medically complex or medically fragile. They also do a lot, kind of policy watching and kind of keeping a pulse on anything that might be affecting services or Medicaid or their access to services. And so I know in the past they've kind of done some lobbying and things like that, but they put some really good information out on their Facebook page, when people are looking for some very specific service or a piece of equipment or a very, a specialist or something. And it's just a good place for parents to gather and connect and learn from one another. So it's just a good resource to have knowledge of. You can go to the next slide, Nicole.
Okay. Thank you. I forgot I was.
You're fine. The ARC of North Carolina, we know the ARC is, a national organization. It's been around for a long time. And one thing you'll see in some of these organizations, such as the previous one and the ARC and the one that's going to come after, there's so many awesome groups out there that actually all started by parents, a group of parents that kind of either saw a need and got together and said, let's do something about this. And the ARC is one of those organizations. And so when we do any trainings on parent leadership, this is one of the organizations that we'll talk about and say, this was just a small group of parents that said, hey, we've got kiddos with intellectual and developmental disabilities, but we don't have the services that we need, or we're not getting the support that we need. And so the ARC provides some of the services they provide are direct to individuals as far as helping them to prepare for independent living, housing. They can, some of the different chapters help with job employment, supported employment, but they also put out a lot of good information on just advocacy, guardianship. And so it's a good place to go and, sign up for their emails, see what kind of events that they're putting out. And then if they have a chapter in your area, seeing what sometimes, back in the old days when we could all do stuff in person, there was a lot of great events, but a lot of these groups are getting really creative and finding ways to connect virtually. And so it's just a good resource to have. And again, they serve, I think sometimes people get confused and think the ARC is only for individuals that maybe have Down syndrome, but they actually serve all individuals that have intellectual and developmental disabilities. And they're not just limited to children, they have programs for them as they go into adulthood as well. Next slide. The Autism Society of North Carolina, again, another group that where some parents got together and said, hey, we need to get something better in place, or we need to talk, or we need to get information out there. And so they've got chapters across North Carolina. And so they also have specific consultants for different regions. And so, and they have a ton of Facebook groups. They've got their main Autism Society of North Carolina Facebook group. And then they also have individual groups that are more county or region specific. And so again, they just have some good information. Someone says, hey, I'm looking for ABA, we can't help them with that. But if you go into a parent group and somebody could say, I love this person, or this person's great, but they got a waiting list, or they don't take this insurance. And so they have a lot of opportunities for parents to connect with one another. And they also just put out a lot of really, really good trainings on, behavior, the transition to adulthood, preparing for the IEP, all of that stuff. And they also, some of the chapters are now providing direct services to individuals as well, or clinical services. And so I get their newsletters, I follow their pages. They've got all kinds of events that they're always putting out there. And they also have a lot of recorded modules on their page. And they have a whole toolkit on transition. So it's just a good place to connect with others. And again, if you have a child with autism, it's a good place to get specific information on autism. Now I will pass the mic.
All right, so I'm going to talk a little bit about CAPC. So CAPC stands for the Community Alternatives Program for Children, and it's a program for medically fragile children or complex children under the age of 21 who are at risk of living in a nursing home. So by providing in-home nursing care, case management, and other supports, CAPC can help children stay comfortable at home. So for CAPC, the children or young adults have to have serious chronic medical diagnosis that requires in-home nursing-related care, and then they have to be at risk for institutionalized care. And they have to be approved by Medicaid, and with this, only the child's income is counted, not the parent's income. So it does help provide in-home care aid services, financial management, assistive technology, community transition, home accessibility and adaptation, respite, participant goods and services, specialized medical equipment, supplies, training, education, and vehicle modifications. And to apply, you can apply at your local DSS. You can apply online at the DHHS website. And then many county websites do list the case management agencies for each county that can help you apply. So each county is going to have 2 or 3 agencies that do handle CAPC. So if you need help applying, you can contact ECAC or the helpline. Next slide, Nicole. And the next one is going to be the Carolina Children's Communicative Disorders Program Grant. So what this is, it's funds that help hearing aids and other devices for children with hearing loss in North Carolina. So it covers hearing related care and devices for children under 21 years old. So the family does have to have a financial need and not be eligible for other state funded healthcare programs. And then consideration is given to the following like financial aspects of the family. They do look at the gross income, the number of dependents, so the number of children in the family, and then the number of children with communication disorders. So they do consider extenuating circumstances such as additional medical expenses and very high insurance deductibles. So that's a little bit about the Children's Communicative Disorders Grant. All right, next slide. And the Carolina Parent Special Needs Resource Directory includes organizations, stories, programs, resources, and events that serve families of children with special needs. And is a one-stop parenting resource with a daily calendar of events, locally generated stories, and area guides and directories that are updated year-round. And I will pass on to the next.
So Decoding Dyslexia is they have a national group that helps families with children with dyslexia or that might be affected by dyslexia. They also have an organization in each state that help with, so families know or professionals know about those regulations or policy changes around dyslexia services. And there's also a Decoding Dyslexia military Facebook group. So it's a great resource for families with children attending public schools that have questions about dyslexia. So Department of Defense Education Activity, or DODEA. Here in North Carolina, we have DODEA schools at Fort Bragg and Camp Lejeune. And I think it's important for families to know that they have their own policies and procedurals, safeguards, handbooks. So they don't follow the North Carolina education, special education policies. They have their own special education policies and they have their own processes for how to handle complaints and that things. And so provided the website to find the school information for the Mid-America region, which is considered Fort Bragg and Camp Lejeune fall under. And if families have information, they can always contact their EFMP or their school liaison officer or contact me to help them with anything like that. The Disability Resource Center is located in the Wilmington area. They are around to help adults and find work with that have disabilities. They offer a weekly book club on their website. They talk and they have peer support group meetings virtually through Zoom. They have a great resource handbook on their website, and we'll provide the link for that as well. And they last summer were offering a virtual 4-week summer camp in the July timeframe. I've checked their website several times and wasn't able to locate any information about this upcoming summer, but you may want to check their website periodically to see for more information about possibly upcoming summer camp opportunities.
Yeah, and last summer they, since it was a virtual experience, they opened it up statewide. So you
Yeah,
didn't
that.
reside in one of those counties.
Yeah, thank you for reminding me about that. That's great. Great opportunity. Guess I'll pass it back to you.
Okie doke. So Disability Rights North Carolina, they are our legal advocacy agency, and they are all about fighting for the rights of people with disabilities in North Carolina. And so they will handle cases that involve discrimination, abuse, and other rights violations, and everything that they provide. Everybody they provide services to is at no cost. And so they have targeted work that they do. And so not all of it, it's for adults and not just children, but some of their focus areas right now are prisoners with disabilities. They are looking for folks to provide input and share their feedback if the individual or if the parent of a child was maybe placed in a PRTF, a psychiatric residential treatment facility. They're wanting to hear those stories because there is a high amount of abuse that occurs. And so they have target topics and target populations that they're usually trying to reach out to. And in fact, we are going to be hosting a webinar. They're going to be presenting a webinar on seclusion and restraint in the school setting. And so that's going to be offered around the end of March. But they have a lot of opportunities for folks that are interested as far as policy concerns in the state, opportunities for folks to use their voice. They put out some really good information for people to understand their rights as far as maybe housing, service animals, employment discrimination, things of that nature. Next slide. So Dream13, they're a nonprofit organization that's they're headquartered in Charlotte, North Carolina. But they actually opened up their program to different areas. I think Georgia is included, and then all of North Carolina. But one of the cool thing that they do is they create these, kind of make these dreams come true for individuals that have either a chronic illness or intellectual and developmental disabilities or any life-altering condition. And so they're kind of sports themed dreams, and they try to make these dreams come true for individuals. And so if somebody is a huge basketball fan, or maybe there's a certain player that they idolize, somebody would have to nominate them, that youth or individual, because it has to be somebody under the age of 21, and share what their dream is, and they try to make the dream happen. And so one of our youth, Nicholas, on our youth advisory team, a young man with autism, when he had his dream come true, and I can't remember because Nicholas loves so many sports, it's hard to keep up. He is like a sports guru. He could school any of you. He knows dates, he knows who, when, how. But NASCAR is a huge interest of his. I'm wondering if they did something around NASCAR, but it's just it's a cool little thing to know about, especially if you know of a youth with a disability that is a diehard sports fan and has some experience that they would like to see happen. These are the folks that can make it happen. Next slide. So the Duke Children's Law Clinic, they provide free legal advice, advocacy, and legal representation to low-income families. Now, for a time, it was specific. It was county specific. You can see all the counties on the screen that they were serving. But they do a lot as far as educational rights and a particular interest in special education and school discipline. And so they now, like a lot of folks, now that a lot of things are being done virtually, they are opening up their catchment area depending on the situation and the concern. And so they are open to serving families outside of these counties. They have a very strong interest in systemic advocacy right now and are, interested in learning more if there is a systemic problem somewhere in the state. But they have a really, really, really great resource that we refer to often, and it is the Parents Guide to Special Education in North Carolina. It's available on their website. We put it on our website, and they put a ton of frequently asked questions in there, frequently used terms, a bunch of just scenarios, sample letters, and it's very user-friendly language. And it's an awesome resource. And I refer to it often when I'm assisting families and, with their particular situation. And we're actually collaborating with them and in the works of having that documented, translated into Spanish. So I'm excited to make that available. And next.
Next is the Educational and Developmental Intervention Services, or referred to as EDIS. So EDIS is the military early intervention if there is a DODEA school where you're located. Those families that live on the installation are served for their early intervention needs through DODEA, and I think that through EDIS, because they have the DODEA schools there. So I think it's a great resource. A lot of families haven't heard of what this is. So if you're coming to North Carolina and you're going to be residing on either Fort Bragg or at Camp Lejeune, and you need early intervention services, you would utilize those through EDIS. And next is the Exceptional Family Member Program. This is mandatory enrollment for us military families if we have a family member with a disability or a special health care need. And it's great support. They offer great support, resources, referrals, help with transitions. My family has been in the EFMP program for 16 years with our youngest daughter. I think, Jody, are you with us today? I didn't know if you wanted to say a little bit about, I think we have one of the EFMPs with us. If not, that's okay. We have listed all the links here for the EFMP's websites for each of the bases in North Carolina. Going on, the next resource is the Family Resource Center of South Atlantic. The Family Resource Center of South Atlantic has delivered effective, qualified services for Wake, Durham, and supporting communities, providing intervention and prevention services to strengthen families and communities. They're a family-based, family-centered agency, and they have standings in multiple different programs. They offer a wealth of programs on their website, peer-to-peer support, bowling. They have a social group for youth that was meeting virtually. A lot of really great support programs that they have to offer.
So the Family Support Network, they've got a bunch of chapters across the state, and it's an organization that we often will pair up with and collaborate with, because our customers or consumers are pretty much the same. It's all about serving North Carolina families that have a child with a disability or a special health care need. And so they do a lot of parent-to-parent matching, as far as matching parents with another parent that maybe is in a similar situation or has a child with a similar condition. They offer a lot of support as far as support groups, and some of them are often population specific. So sometimes they'll have a support group like the SIB shops. They do that for siblings of children with special needs. Some of the different chapters have some that are specific to dads. Some have chapters that are specific to Black parents. They do a lot with NICU families. They have a heavy presence in NICUs across the state, and really trying to get information into the hands of those families that maybe have a child that's going to be spending some time in the NICU. But they connect families in their region with a variety of different resources, and they also promote parent leadership and offer a lot of trainings on getting parents to think about using their voice and serving on decision-making groups.
Amy, it looks like we have a question
Sure.
or someone raised their hand. Jamie, did you want to come off mute and ask the question? Ask your question?
I was gonna say, I didn't see anything in the Q&A box, but what do I know? Zoom.
And I can't see all the participants' hand raised.
Well, if so, throw it in the chat box. Oh, there it is. Okay. Oops.
Oh, okay.
But I did come off mute. Oh, yeah, we might have her. I don't know. Is there a way that we can, if she would like to say hi?
Oh, can we?
We'd have to go in.
Oh, I can unmute.
Okay,
yeah.
gotcha. Oops.
Jody, did you want to say anything and add anything about the EFMP?
I could say hi.
Okay, thank you. You're unmuted, so feel free to.
I don't hear her. I don't know.
Okay. And I think it was Jamie who had a question. I can take her off mute. Oh, thank you, Jody. Jamie, you're unmuted if you had a question. She had her hand raised.
Now I see them showing up here, but I don't see.
Oh, she's good. Okay.
They're muted for me.
Yep, they're muted. I guess we have to allow them to talk. So.
Gotcha. You can go to the next slide whenever you're ready to.
Okay.
So the family support program, they also are lined up with the folks at the Family Support Network. But one of the reasons I wanted to include this slide is because every year they put out a summer camp guide, and they actually just released it earlier this week. We posted it on their Facebook, and they've got it on theirs and on their website as well. But they do a really good job as far as listing what's out there, and their directory will put it alphabetically by county, and then also they will put them by disability types that camp might serve. And so I haven't looked too much at this year's guide to know what are people doing. Are they doing in person? Is it going to be virtual? Is it hybrid? Is it a little bit of both? I don't know, and it might be too soon to tell, but they at least put that information out there, and a lot of families look forward to that, to see what kind of opportunities or extracurricular opportunities might be available for their kiddo. You can go to the next one.
Okay.
First and Families. I love telling folks about this group. Again, this is another group that was a couple parents that got together and said, hey, we got a need here that we need to meet. And so one of the cool things that they do is provide grants to North Carolina families. And oftentimes when there's money out there that, parents could maybe access, it's very specific as to how and what it can be used for. And this group lets the family define and determine what their self-defined needs are. And so it's really a cool thing. Sometimes people will, contact them and say, hey, I needed to put towards this camp, or maybe I need to get a weighted vest, or maybe I just, the extra cost of these medication. And so they fill out an application. And then those folks, they try to serve as many folks as they can. But it's specifically for North Carolina families that, or the individual themselves that has a disability, or their families, their family members. And so I wish I was trying to think of when those grants usually get released, and I feel like it's this time of year, but I could be wrong. If anybody else knows, just holler. But they've got chapters across the state. Unfortunately, they don't have enough chapters, I think, to cover every county, but almost most counties do have a chapter where they can go and just get some, again, they provide information, support, but they have this particular grant to help families meet their needs and get the services that they need. And you can go to the next slide. So Gigi's Playhouse, I'm sure a lot of folks have maybe heard of Gigi's Playhouse. It's a really cool program, and it's specific for individuals that have Down syndrome. For years, there was only one in Raleigh. They've branched out and now have one in Charlotte. But I felt like it was worth mentioning it because, just in case, I think most of the people that are here today are on the eastern part of the state, but just in case you relocate to another part of the state, but also, again, just on their website alone, they have a ton of really good resources and information, and they're doing some stuff virtually now as well. And so if you do have a child with Down syndrome, it's a great place to go and kind of learn about, what you can be doing at home to help with your child's development and preparing for that transition to adulthood, advocacy, all of those things that are important to being a parent of a child with special needs. And the next slide.
Okay.
Which I think, I'm trying to, I can't read my own writing. Is that you or me, Nicole?
Oh, it's me. Sorry. I was trying to look too. I'm like, is that one me? So Legal Aid of North Carolina is a statewide nonprofit that helps families with any legal issues, serving children in the public school system. They have a focus on cases that involve short-term and long-term suspensions, involuntary transfers to alternative schools, denied enrollment, and discrimination based on race, national origin, sex, or disability, mistreatment by the school, security personnel, special education, bullying, and academic failure. And they have a great advocacy toolkit on their website as well for parents. They do have some parameters for when they're working with families. The child must live in the household with an income not more than 187% of the federal poverty level or live in foster care. So it's a good resource to put out there. It may benefit some families and it may not be able to help some other families, but checking to see.
Yeah, last year when COVID went down, they actually put out some really good COVID related resources for parents that have a child that was receiving special education. And so I kind of just happened upon it one day and I was like, oh, I need to know about this. I need to get this in the hands of families. And so they do a lot of focus on educational stuff for kiddos, and especially those that have special needs.
Mm-hmm. So the Mental Health of America in Central Carolinas, they're focused in Mecklenburg and Cabarrus County. However, they're offering virtual meetings open to all families in North Carolina, youth in North Carolina. They have a parent voice program that is staffed by parents and caregivers of youth with emotional and behavioral and mental health concerns. They provide trained and caring family support specialists to help families navigate the education and welfare and juvenile justice mental health systems. They also provide an opportunity for parents to connect with other parents and caregivers facing similar issues. They offer family support as well to assist parents as natural supports by parenting with families who navigate their education, navigating their education, child welfare, mental health, juvenile justice, helping parents prepare for meetings and accompanying them sometimes to school meetings and meetings with service providers and those kind of things. And they also offer support groups. They also have a virtual parent and caregiver empowerment group. And so we have their link, and it looks like they have an active Facebook group as well.
This is such a good resource for families who, all parents need support, but this particular population has some really unique challenges. Most of the time when we're talking to families that have a child with significant behaviors, these parents have tried everything. The school has tried everything. Everybody's exhausted every resource out there. And so there's often just a lot of isolation, and just, they feel defeated. And so this program really helps to match parents, and they just get to be amongst people that get it and are going through the same thing. And just a good place for them to find support. And then they have that group that's specific for youth that have some behavioral challenges or mental health challenges. So they've got a virtual youth group as well. And so when they said, when COVID happened, again, this is another group that was kind of county specific, but they said, no, we're going to open this up statewide. And so that was it. There are some good things that came out of COVID, is that a lot of the resources that were limited to certain areas have said, no, we're going to open up our doors to everybody in the state.
Yeah, I think that's great, because there are so many kids dealing with more mental health issues now too, with all the COVID stuff. So moving on to the next resource is the Military Interstate Children's Compact Commission, or referred to as MIC3. This is for family members of the active duty family members of the armed services, and including members of the National Guard and Reserve on active duty orders, veterans who are medically discharged or 1 year after retirement, and then also for members who have died while serving on active duty or a period after 1 year of their death, family members of those individuals, and then ununiformed members of the commissioned Marine Corps, or the Corps of the, this one's a tongue, of the National Oceanic and Atmospheric Administration. Sorry, that was a tongue twister. And the Public Health Services as well. This is a great program for military families. It helps with it covers 4 areas: educational records, immunization. So our military children, we have 30 days to obtain those immunizations once we move to a new location. However, that does not include TB testing. It also has kindergarten and first grade entrance age. So if our kids start school in a different state, say California, and it's 5, and they move to South Carolina and it's 6, they would still continue in that same grade that they were in. It also offers placement and attendance provisions around course and educational program placement, special education services. It says that follows IDEA. So really making sure that the school, for special ed, it's that they follow IDEA. But when you think about this program or provisions, it covers, these military kids get all the extras of all this stuff along with IDEA. So program flexibility, absences related to deployment activities, which can be really beneficial because our service members, they don't always get to be home over holidays or birthdays. And so taking some time for your family when their service member is home, and those absences can be not counted against that child. And then eligibility for student enrollment and extracurricular participation in extracurricular activities. They don't have to hold a spot for our students, but they have to give them the opportunity. So it's all about creating that equal transition for our military kids. And then the other provision is around graduation, waiving course required coursework for graduations if similar coursework had been completed. So I have a lot of military friends that were military brats, and they had completed 5 history classes before they could graduate high school. So this really helps prevent that. And then it also allows flexibility in accepting state and exit and entrance for course exams, national achievement tests, alternative testing in lieu of testing requirements for graduations in the in that new school or receiving school. And it allows also for a student to receive a diploma from a sending school instead of a receiving school. And unfortunately, with us military families, we transfer every 1 to 3 years. And sometimes that's as our kids get older in high school, you have that kid that's transferring as a junior, and they may be more beneficial to receive that diploma from the sending school instead of the receiving school, or if it's a senior year transferred. Next resource is the Miracle League. I love this resource. Our daughter took advantage of it when she was little in South Carolina. So this is a national resource. They're all over. Players are ages 5 to 22 with any diagnosed disability, cognitive or physical, or has an IEP or 504 in school, are welcome to join the youth or adult divisions. Buddies are offered for the player, providing any physical assistance needed as well as encouragement. And so we've provided the link for the Miracle League here as well. There's also the Miracle League of the Triangle, a Miracle League of High Point, Charlotte, Franklin County, William tongue twist.
Wilmington?
Wilmington, yes, thank you. Indian Trail in Johnston County. I'm going to go ahead and pass it over to Nikki.
All right, so I'm going to talk a little bit about NAMI, which is the National Alliance on Mental Health, and it does help provide public education workshops, webinars on specific issues, and provides free program leader training. So some of the programs that they have include Family to Family, which is a free 8-session course taught by trained volunteer teachers who themselves have a family member or loved one with a mental illness. They have a NAMI Basics course, which is a 6-week education program for parents and family caregivers of children and teens who are experiencing symptoms of a mental illness. And they have NAMI Homefront, which is a free 6-session educational program for families, caregivers, and friends of military service members and vets with mental health conditions. They have peer-led NAMI support and advocacy groups, and they also offer free presentations to the community and to groups in North Carolina to help improve their understanding of mental health. And the North Carolina Assistive Technology Program provides device demonstrations, loans and training, technical assistance, public awareness, and assistance with obtaining funding for AT equipment. It also works with the local management entities or the LME MCOs to develop additional capacity and resources for assistive technology and augmentative communication assessments. And this is NC Care 360. So NC Care 360 is a brand new initiative that the state of North Carolina has undertaken. And it's a statewide network of organizations that can help provide you with referral links to some different supports that you need. They help with benefits navigation, clothing and household goods, education, employment, food assistance, health, housing, mental, behavioral health, transportation. And it is available in all 100 counties, and it is free and confidential. And the agencies do receive referrals for the services that you are in need of, and that they do assist you, they do follow up, and they do make sure that you have been helped. So this is a great new initiative that North Carolina is undertaking to help link those in need to different services or multiple services all at once to be able to receive assistance. And this is the helpline for children with special healthcare needs. So this is where I spend my days. So it's a toll-free number and email for caregivers and professionals who work with children or have children with special healthcare needs. The helpline does also serve children and youth in all 100 counties, and it provides information on local resources for families and professionals. Some of the calls that I get on the helpline and provide information on available resources, things like services available under government programs like Children's Health Insurance and SSI, how and where to apply, financial resources available to assist families in paying for therapies, medications, or AT equipment when insurance is not enough, healthcare and dental providers available through Medicaid, information on how to find services when relocating to and within North Carolina, and also just basic guidance on healthcare transitions and guardianship. And of course, last but not least, I help provide information on disability grants, early intervention, special education services, and community resources. So feel free to contact the helpline at 1-800-737-3028, or you can email at cyshcn.helpline@dhhs.nc.gov. And I will pass it on to Amy.
Look, I'm just going to let everybody know right off the bat that if you see me run across the room right here screaming or see things flying, there's a stink bug that I got my eye on. It's too high for me to reach, but if I become under attack, I'm out of here. I hate those things. I'm highly distracted right now. The next slide is on the North Carolina Complex MHDD resources. And so this site came up, I kind of just came across it, I think a little less than 2 years ago. But they're based out of the University of North Carolina, Chapel Hill, and their work is funded by the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. But this program is particular for parents, caregivers, physicians, community members, and other staff such as school professionals who care for people with intellectual and developmental disabilities who are also experiencing mental illness. And so on their website, they've got it kind of broken down into sections as far as resources for parents. And some of those are as far as crisis response for families, medication guide for families, information on trauma. They've got some resources specific to schools and communities as far as communication and school-based interventions. And then for physical and behavioral healthcare providers, they have information again on behavioral health crisis, evidence-based practices for individuals that have both intellectual and developmental disabilities, a medication guide for providers, but they've got some really good topic specific information for this specific population. And that would again be those folks that have both intellectual disabilities and also are experiencing mental illness. And you can go to the next slide. So NC START, we have been collaborating with them more and more, and I'm excited about that because they are a really, really good resource for families that have a child over the age of 6 that also has intellectual and or developmental disability as well as complex behavioral health needs. And so their focus really is on crisis prevention and intervention, and they do a lot of consultation and training and therapeutic coaching and collaboration with the families and also the other systems that are serving that child. And so I know there's like an NC START East, there's an NC START West, I think there's one in the center as well, but we've been doing a lot of webinars together with them on the topic of behavior. And certainly seeing an increase in some of those students that have some behavior concerns with remote learning. And so they've just got some really good strategies and tips, not just for families, but also for professionals. Next slide. The North Carolina Council on Developmental Disabilities, otherwise known as the NCCDD. These folks do a lot regarding policies. They work collaboratively, now I'm having word trouble, across the state to assure that people with intellectual and developmental disabilities and their families have access to much needed services, individualized supports and other forms of assistance. They do a lot of kind of virtual town hall stuff. They offer a lot in Spanish as well. They really try to figure out what are some of the unmet needs in the disability community. One of the other things that they offer that I really love is something called the Jean Wolfe Rossi Fund for Participant Involvement Fund. It's a lot of words, but basically they have some money that they set aside for individuals with disabilities or their family members where they can go and get reimbursed if there was a conference or a seminar that was designed to improve their knowledge or their skill levels for advocacy. Folks can apply for this fund, they can go and attend it, and then they can get reimbursed by the North Carolina Council on Developmental Disabilities. I actually utilized this gosh, many years ago, there was a kind of like it was called a Happy Mama retreat. And it was a retreat that was taking place in North Carolina, specifically for moms of children with disabilities. And they actually reimbursed me so that I could attend that. And even my daughter was able to learn how to use PECS, the picture exchange communication system. She was able to take some courses and got reimbursed by these folks. And so I know some families that have contacted us over the years that wanted to do some of these national level disability type conferences. And so they'll even pay for reimburse folks for out of state and in-state things. And so again, it's available for the individual with a disability, but also their family members. And so it's a good thing to be aware of. Next slide. So the North Carolina Deafblind Project, Nicole mentioned when she was talking about some of the different programs that ECAC is part of, and the North Carolina Deafblind Project is one of them. In fact, our coworker, Deborah Pickens, she's a parent educator, but she's also the co-director of the North Carolina Deafblind Project. And this is a collaboration between ECAC, the North Carolina Department of Public Instruction, and East Carolina University. And so it's a grant funded project. And basically what they do is they provide technical assistance and support. And their focus is all about those children or youth ages birth to 21 who have both, that are both deafblind. So we've got some folks out there that are just deaf, and we have some that are blind, but we actually have some that are both. And this is a very specific project for those individuals that have that dual diagnosis. And so they do a lot as far as making sure that folks get on that deafblind census. Deborah, our coworker, she attends a lot of IEP meetings for families that have a child with deafblindness, just because there are some very unique needs that come up. And so she can really help those families understand some of their options and maybe some assistive technology that they may want to consider. And they do a lot to promote parent leadership in that group as well. Next slide. So, you know, the North Carolina, well, all Department of Human and Health Services, they have so many things, different programs and departments and activities that they do. And so you'll see some slides like, didn't we already talk about that? But they're all do a lot of the same, but some of it is very specific as far as maybe a disability type. And so the North Carolina Deafblind Services through NCDHHS, basically they are there to really try to improve the quality of life for individuals that are experiencing both deafness and blindness. And so they too provide assistive technology, they help with employment services, and they offer specialized training to really kind of help those folks prepare for independent living. And next, so I think I'm passing the mic. Am I or aren't I?
Back to me.
Yeah, back to Nicole. Okay.
Yep. So the North Carolina Department of Public Instruction Exceptional Children's Division. I know for me, being a military family, moving here to North Carolina, when I was trying to register my kids and find out what services for special education was available, it was kind of shocking to find out that it was called the Exceptional Children's Division. This is the North Carolina Special Education Division, and their mission is to ensure that all students with disabilities develop intellectual, physical, emotional, and vocationally through the provisions of appropriate individualized education plan in their least restrictive environment. And we've provided their website here. You can find their forms and instructions available on their website. The Parents' Rights Handbook is there. The policies governing services for children with disabilities is on there. And then the dispute resolution options. The next resource is the Division of Services for the Blind under the North Carolina Department of Health and Human Services. They can provide tools and services and education that you'll need to be an active participant in the community regarding your visual disabilities. And they have materials that can be changed into Braille for other agencies or groups or individuals. Their communication unit produces materials in alternate format, primarily into Braille. And then you can request the materials there. However, there could be a per page, they have a per page fee. They also have a Camp Dogwood that supports individuals who are blind or deaf in camping experiences at Camp Dogwood. It's located near Lake Norman, and it is supported through the Lions Foundation of North Carolina. The North Carolina Division of Services for the Deaf and Hard of Hearing works to ensure that all deaf and hard of hearing or deaf blind North Carolinians have the ability to communicate their needs and receive services and information effectively in all aspects of life. They offer such things as captionists and relay operators, domestic violence support and resources, emergency preparedness and public safety, information for deaf and hard of hearing, sign language interpreters, technical assistance for agencies, telecommunication access for the hard of hearing or deaf, and then telehealth resources as well. The North Carolina Down Syndrome Alliance, they have their mission is to connect and empower families and support them through the lifespan of the individuals with Down syndrome, their families and community through outreach and advocacy in North Carolina. They have a program called the Learning Program. It's a 10-month program that uses effective teaching strategies and customized materials to support families in the educational process. The Learning Program gives formal instruction in literacy and math and occupational and speech therapy components. They also have a parent information packet, and they have some other programs as well. They offer a North Carolina Down Syndrome conference, and it's free for older teens and adults with Down syndrome. They offer the Best Buddies program, PALS program. They're involved in the North Carolina Advocacy Day. They have volunteer opportunities as well. And they also have the Down Syndrome National Congress's National Self-Advocacy Program. And then the North Carolina Families United. This program links families to state and community partners through the purpose of improving the lives of children with and youth and families with emotional, behavioral, or mental health needs, focusing on the unique strengths and needs of these children with their families by educating and advising policy makers and service providers and other advocacy organizations, promoting policies and procedures that serve the best interests of these children, youth, and families throughout work with state and local officials. And they promote and model and adhere to the values and principles of the system of care. Services are available for North Carolina families and organizations and system of care sites and family partners. They partner with the North Carolina Families United. They can help link you to services in your community with mental health, social services, educational services. They work with other community organizations and 501c3 mentorships. And they also have a program for family advocates and parent partners as well.
All right, and I'm going to talk a little bit about the North Carolina Health Insurance Payment Program, also known as the HIP, H-I-P-P. So it does help provide payment reimbursements to Medicaid families for the cost of their employer-sponsored insurance. The North Carolina HIP program provides the opportunity for Medicaid recipients to have both Medicaid benefits and commercial health insurance at no cost. And to be eligible for the HIP program, at least one family member must be Medicaid eligible and at least one family member must have access to employer-sponsored insurance.
I'm sorry.
And the North Carolina Infant Toddler Program. Early intervention provides various supports and services for children up to 3 years old who have disabilities or delays in one or more areas of development. For example, it may be a delay in speaking, thinking, learning, moving, or seeing. And early intervention in North Carolina is called the Infant Toddler Program, or the ITP, and it is a federally funded statewide program. And you can find your local CDSA by going to the website, to the beearly.nc.gov, and you can type in your county and you'll be able to pull up the local region for your CDSA. And next is the North Carolina Innovations Waiver. The Medicaid Innovations Waiver supports individuals with IDD to live the life that they choose, and waiver services are administered by the local management entity, the LME MCOs, which do help facilitate the services and oversee a network of community-based service providers. And individuals who receive waiver funding work with their team to develop a person-centered plan of care and request the services and supports they need. And to be eligible for the Innovations Waiver, you must meet the requirements in an intermediate care facility for individuals with IDD and have that level of care, live in an ICF or IID, or be at risk of being placed in a facility. And you have to be able to stay safe, healthy, and well in the community while using waiver services. And then that you do have to need to use the waiver services at least once a month. And then also want to use the innovation waiver services instead of living in a facility. And to apply for the North Carolina Innovations Waiver, you can contact your LME MCO. And also there are only a certain number of Innovations Waiver slots. And if the slots are full, which there is a very lengthy wait list for most places in North Carolina, you can get added to the registry of unmet needs. So some of the services that the Innovations Waiver does help cover are assistive technology, day supports, respite, community living and supports, community navigators, home modifications, respite care, both in home and out of home to relieve the primary caregiver. And that's the Innovations Waiver. And the next slide is the North
Nikki,
Carolina.
do I even dare ask what is the waiting list like? Change in
So,
counties?
yes.
Is it some counties are longer than others?
Yes, from what I've heard, some families I've heard they waited, a couple years in some of the like smaller, more rural parts of the state. Like I want to say it was Bladen County where that mom said she waited 2 years for her kids. Both kids got on, but then in some areas like Greensboro, like larger areas, it's 10 to 15 years.
That's what I thought.
So that's what
It's a lifetime.
Yes, so it's definitely, and that's the issue we're having. I'm on a lot of the different groups that are having that discussion that this is, the waiver is for children, but unfortunately the wait list is so long that children are, over 18 or they're adults by the time that they're actually, able to receive some of the waiver services. So with the helpline, I always encourage like families to like definitely get on if it's something that they're even, considering for like a kind of long-term projection, at least so they at least know about it and can at least get on the wait list. And definitely encourage families I hear that they should constantly check their status on the wait list as well, because I've had families that were thinking they were on the wait list and for whatever reason, were no longer on the wait list. So definitely, if you are on the waiver wait list, give your LME MCO a call, periodically just to check up on kind of where you are, kind of how it's moving to make sure that you still are actually on that wait list.
I just want to speak real quick to that because my daughter's on the wait list and we've utilized Medicaid in 5 different states being military family. And we are on the Innovations Waiver and wait list, and she does receive unmet needs through developmental therapy. And we were also able to get the funds to do her special needs trust through being on the wait list. And it's a great, even though it sounds like it's forever long, I think it's really important to encourage families to apply for it.
Right.
So I just wanted to put that out there that, yes, it is crazy long here in
It
North
is long.
Carolina, but that registry of unmet needs is really important because there's so many different benefits that open up periodically. Move on to
Excellent. All right. So the next slide we have is the North Carolina Lifespan Respite Project. So that is for families who don't qualify for other income-based respite. And so the North Carolina Lifespan Respite Program is an application-based program that reimburses eligible family caregivers for caring for individuals of any age up to $500 in respite care services in a calendar year. Funding is limited and applications are accepted only when funds are available. So applications or applicants must be referred to the program by a local professional organization. And then the referring agency will then complete that online application on behalf of the caregiver. So neither the caregiver nor the care recipient can receive ongoing publicly funded in-home services or other respite care, including adult day services. So that is for those folks that are not able to get any other types of respite. So this is something that's available for those families. And next slide. And the next one we have is the North Carolina Medicaid and Health Choice, also known as our children's health insurance programs. So Medicaid and Health Choice offer different ways that help pay for some or all of the costs of health care. So each program helps people and families with certain health needs and income and resource limits. So Medicaid and Health Choice are for low income beneficiaries, and your local DSS caseworker will help determine eligibility. And North Carolina Health Choice starts at age 6 for children. So Medicaid and Health Choice may be available to people who are age 65 and older, blind or disabled, infants and children under the age of 21, low-income individuals and families, persons in need of long-term care, and persons receiving Medicare. And to be eligible for North Carolina Medicaid and Health Choice, you must be a U.S. citizen and provide proof of eligible immigration status, live in North Carolina and be able to provide proof of residency, and have a social security number or have applied for one. And if you're automatically eligible for Medicaid if you receive any of the following. So that's supplemental security income or SSI, the work first cash assistance, or any state or county special assistance for the aged or disabled. So there are 3 ways that you can apply for Medicaid or Health Choice. You can always apply online, of course, through the system called ePass. You can apply it in person at your local DSS, although now with COVID, I would definitely call and check your local office for their restrictions. And then you can always fill out a paper application and mail it or drop it at your local DSS office. So that is our North Carolina Medicaid and Health Choice. And I will pass it over to Amy.
Thank you. So next up is the North Carolina NC Pre-K program. And so this is a free state-funded early care and education program, and it's all about enhancing children's school readiness. And so one of the cool things is typically this program does have some income requirements, but children of certain military families are also eligible without regard to income. And my granddaughter, the house I'm sitting in, my 4-year-old granddaughter, she is one of those lucky recipients. She's actually attending the NC Pre-K program in Davie County at no charge. And so they, like I said, they have some income requirements, but they also have some requirements to serve others outside of that income, specifically those that might have a developmental disability or limited English proficiency, an educational need or chronic health condition. And so it's something that would be available to look into. You know, sometimes we see things out there and we go, well, even though I'm broke all the time, I'm not going to meet the income requirement. But there are sometimes you'll see some different provisions where they will waive some of that if it is perhaps a child of a military family member or if it is a child with a disability. Next slide. The North Carolina State Education Assistance Authority, these are the folks that provide the K-12 funding for those that are interested in knowing what their school choice options are. And so they actually have 3 different programs. That one is called the it's not what it's called. It's called the Opportunity Scholarship, not the Occupation Scholarship, the Opportunity Scholarship. And so this is for families that either want to enroll their child in a private school or possibly even want to homeschool. In North Carolina, children that are homeschooled are considered to be enrolled in a private school. They're, in the eyes of the state, that is one and the same. And so they have 3 different programs. The first one, the Opportunity Scholarship, is income-based, and they can provide tuition assistance up to $4,200 per year. It's open to all students. So this is not specific to students with disabilities, but students with or without disabilities could apply for that Opportunity Scholarship. But they do have 2 programs that are specific to students with disabilities. And one is the Disabilities Grant Program, and that could provide assistance up to $8,000 per year. And the other one is the Education Savings Account Program, which could provide assistance up to $9,000 a year. But they do have some requirements. There has to, the child typically has to have spent at least the whole spring semester or the last semester in a North Carolina public school, unless they're, just starting kindergarten. They have to have been found eligible for an IEP in North Carolina. And so they do have some requirements as far as eligibility. And those applications are actually open right now. And some of them have deadlines, usually around mid-March. So if it's something that, a family might be wanting to check out, the clock is ticking on that. And I actually know some families that were able to actually get the Opportunity Scholarship and one of the disability grants. And so, because some of those, there's some private schools in our state that are specific to serving children with disabilities. But some of them are really, really expensive, right? And so being able to tap into some of those resources can really make that, a possibility that families could explore. But again, for those families that are homeschooling, they could use that money towards curriculums that they purchase. And some of them can even be used for therapy if that provider is registered with the North Carolina State Education Assistance Authority. And so if you were to go on their website and say, well, I'm kind of interested in this, they have a list of all of their participating schools, because not every private school is registered with them. And so you go to that list and you can say, okay, this group takes the Opportunity Scholarship, this group takes the Disabilities Grant, this group takes the Education Savings Account. The thing that folks need to be careful of if they're going to go that route is, you don't keep the IEP and go to the private school. You would switch to something maybe called a service plan. And so you do lose some provisions when you choose not to consent, to enrolling your child in the public school. And those services are usually very limited as to what the public school would provide. And it's usually limited to speech therapy, and sometimes it's even limited to specific eligibility categories. So there's pros and cons, but families need all the information so they can make an informed decision. But we've had a lot of families that have really benefited from using this program. Next slide. So the North Carolina Voc Rehab, vocational rehabilitation, sometimes referred to as VR. This is a great program that really is, they've got a school to life program geared towards youth ages 14 and up. And so I did not learn about this program myself until I started working at ECAC, and my son was 17. And I was like, man, I wish I would have known about this at age 14. But they really have a focus on helping people with disabilities achieve their goals for employment and independence. And so they do a lot as far as job readiness training, supported employment, job placement assistance. My son was a junior when he started working with them, and essentially that they would send out, his employment specialist would come out and pick him up, and they would go somewhere that had Wi-Fi, usually McDonald's, and they would go and spend an hour together. They would practice interview skills. They would practice applying for jobs. Some days they would go places and get what they would call community or volunteer hours. So they might go to Habitat for Humanity, do some stocking, go to Dollar General, do some pricing. And so they do a lot of interest inventory type stuff. They look at, what do you like doing? What don't you like doing? What are you good at? Where are some challenges for you? And they were actually the ones that helped my son get the job at Lowe's. And so initially when he started working there, she would go with him for the whole shift and then, you know, gradually decrease till she was no longer needed. So it was a really nice support for him to have. And I'll be honest, my son was not happy about going to work. He had this idea that when high school finished, he was home free and it was going to be 24/7 video games and computer and watching movies. And so I kind of said like, hey, no, there's going to be something meaningful and productive with your time. So you're either going to be going to school or you're going more school, which I knew that was out. He was not interested. Or you're going to be doing some kind of work, or you're going to be doing some volunteering. And he was kind of grumbling. He grumbled all the way up until he got that first paycheck. And then when he got that first paycheck, it was like, oh, okay, I see. And so that was a game changer for him. You know, once he got, it's like, I have my own money and I don't have to ask anybody and I can kind of do what I want. It's like, I want to go to Bojangles. You know, back then when there were still Blockbusters and stuff, that was the kind of thing he liked to do. But they are available. You know, folks can contact them on their own. We've got some districts across the state that work very well and hand in hand with North Carolina Voc Rehab. And so the schools are making the connections. We've got some that the parents are finding them on their own. It's certainly something that families could ask the school. They have a transition age youth. Hey, I heard about this program. Can we invite them to the IEP meeting? Can you get them connected with me so that we can start, you know, thinking about life after high school? Next slide. So Smart Start, these folks, these are state funded. It's North Carolina's initiative to ensure that every child reaches his or her potential. And so they're located, I think there's at least one in every county, but they do a lot of stuff to really kind of help parents play a role in their child's development. They also are usually where you can get paired up with the Dolly Parton's Imagination Library. And these, if you sign up through them, basically what happens is that child, any child in North Carolina, or actually probably across the country, ages birth to 5 can get a free book in the mail every month. But I know some of the Smart Starts that I've been to out here in my part of the state, which is kind of just north of Charlotte, is that they've got a lot of tons of books and tons of toys and activities. And so they do a lot to promote play, purposeful play, work on developmental skills. They do a lot to promote parenting. They often have incentive programs. They often have, you know, free car seat checks. Sometimes they even offer free car seats. I know some that have diapers, all kinds of things to meet families' needs. And I know that they did a lot of in-person stuff with the families, and they had to switch things up big time because of COVID and had to do a lot of stuff virtually. But again, everybody's kind of flexed and adjusted to meet those needs. Next slide. Special Olympics North Carolina. These folks, you know, for a long time I thought, okay, all they do is, you know, they have these sports activities, which are awesome, but it turns out they actually do way more than that. We learned that our youth advisory team did a webinar with them to talk more about some of the things that they offer. And so, yeah, they absolutely have a variety of sports and opportunities for individuals with intellectual disabilities, from the young to the very old, to participate. But they also do a lot to promote self-advocacy and leadership. And so they have a whole like ambassador program where they try to recruit members to work on public speaking, to promote the program, to coach, you know, take on some more leadership roles. And this is another group that had to really change things up. And so I know they've done a lot of virtual cheerleading competitions. One of the youth on our advisory team, he's like the Special Olympics North Carolina, I think he's their biggest fan. But they had a dance competition every week. He learned the Thriller dance kind of thing. But I think that they took a little bit of break, but I think they were getting ready to relaunch a bunch of activities for starting in March. So that should be something that, you know, if you got a child or an adult that's saying, I need to move, I need something to do, or I need to connect with some other people, they've got some really good things going on. Or if you have a youth that says, you know, I want to do more, I want to, you know, promote something or talk more, get my voice out there, they've got lots of opportunities to do so. Next slide. The Stogner Scholarship for Autism. This is like a little hidden gem. Now I'm just like, oh, I put it out there, and then everybody's going to know. But it's an important resource that folks need to know about, because this program is specific for North Carolina families that have a child with autism, and they provide funding. And again, it's where folks can come to them and say, here's what I need it for, and here's how much I need. So they don't really cap off how much you could ask for, and they don't really say, but it can only be used for this. And it's because they get it. They know if you have a child with autism, there's so much out there. Everybody's pitching, you should try this, you should do that, you should get your hands on this. And of course, as parents, we want to do everything and anything, but sometimes it's just not financially feasible to do it, right? Or sometimes, even if you have insurance, you've got, maybe you got a huge deductible, or you got a huge copay, or you have insurance that says, yeah, we cover everything but that. And so I actually know some families that were able to apply for this scholarship and get help paying for ABA. And again, like I said, it's not like pigeonholed, like you only get to use it for this, you get to decide. And so their applications usually, I think they're due around December 1st. And so we got a little bit of time for the next round. But it's definitely something, a lot of folks, when they call us, because we have the word assistance in our name, sometimes that's what they're calling us for. They're looking for funds to help them get some of the services that they want for their child. And it's like, oh, that's the one thing we don't do. We don't have any money to give you, but we got an ear. We can, put you in touch with those resources. So this is a good tool for folks to have in their toolbox.
Yes, definitely. And I think now it's really important too. A lot of us military families, the extended healthcare option program, they want us to use community resources first before we use those funds. So I think all these these fee assistant ones are great for us to be talking about today. So the next resource is Supplemental Security Income, SSI. It's a federal program, and it offers monthly benefits to children birth up to age 18 who have a disability or special health care need. There are some income guidelines you have to apply. We have the link on the PowerPoint here to apply at ssa.gov/benefits/disability/apply child. Important thing I want to mention for military families is that there are some of our pays that are not included under the HEART Act from 2008 because of the state our country was in at that time. A lot of families were losing their services because they were receiving hazard duty pay or a hostile fire pay and those kind of things. And so at that time, a lot of families with children that were on SSI and their service member was being sent overseas were losing their benefits. So that there's the HEART Act on their website. You can find information out about that, but they can't count some of our pays. And then also for military families, if they are receiving SSI and they're going to be sent overseas, and they're on command sponsorship orders, they are eligible to keep their SSI for their child until they're 18. However, they do need to report that to SSI, and I'll provide the information in the PowerPoint for how to go about doing that and continue to receive those services. However, if there's any changes, they need to notify the SSI office, and if they are not returning back to the States after completing that tour of duty, they would lose those SSI benefits for that child. So moving on to the Teach Autism program, it's a university-based community regional center that offers core services along with a unique demonstration program, clinical appointment training and research needs of individuals with autism spectrum disorder to their families and professionals across the state. They have initial referrals and consultations, parent support and education, intervention services for toddlers and school age and young adults, and they offer professional training and consultation as well. And I see we went over our time a little bit, but we just have a couple more slides here. Thank you for sticking with us. The United Healthcare Children's Foundation is a grant to help fill in the medical gap, or fill in the gaps between medical services and items the child needs. and whatever their commercial health plan benefits doesn't pay for. The UHCCF grants provide financial help and assistance for families with children that have medical needs that are not fully covered by our health plans. And so we have the link available to apply. However, it is only age birth to 16. And then on this slide, we have some Facebook pages that are for military families specifically. So the first one is advocating for ABA TRICARE policy change. That is a great resource for military families to find out about what's going on with ABA. If you're looking for providers in an area that you have PCS to, it's a really great resource. And then the American Military Family Support, Autism Support for our families with children with autism. That's a great connection tool between other military families with autistic children as well. The Military Family Magazine has a Facebook group. Military Special Needs Network is families from every branch, and you can pose those questions you have about different services you may have tried or resources available, or if you're PCSing somewhere and you want to find out about what is available in that new state, or you're trying to choose, I've seen all sorts of different questions posed in that group. And then Partners in Promise, they are really instrumental in advocating for change for our military EFMP kids, and they're doing a lot of advocacy work. STOMP, Specialized Training of Military Parents Hub, is a great resource for military connected professionals, parent center staff, EFMPs, school liaison officers, and parents as well, to connect and share resources, and webinars are posted on there and stuff as well. And then I want to share the TRICARE Facebook page to get any updates about TRICARE services. And then the last one is, but not least, is TRICARE for Kids. They're an advocacy group around the initiative about helping with policy changes for our severely medically affected children that, like my daughter, we've had Medicaid in 5 different states. They are advocating about changing that so that it's, every time we move, we have to reapply and stuff. And so they have a lot of great information on that site as well. And then, like I said earlier, if there's any resources you would like to share with us, please share them with us. We would love to get more resources to share with the families we serve. And thank you everyone for attending. Our apologies for running over. It's so much great information that we wanted to share with you today. And thank you, Nikki, for joining us and helping us with this presentation. And thank you, Amy, as well. Go ahead, and everyone, I hope everyone has a great day, and please email us or reach out to us via Facebook or go ahead and end it. Thank you, Nikki, so much for being with us today.
Thank you guys. Anytime. I would love to be a part. I love you guys. ECAC is great. So thank you so much for letting me be a part.
Yes, thank you. Everyone have a great day. Bye.